let's get rolling. So welcome once again to Inside the Doctor's Lounge. I'm your host, Dr. Desmond Bell, and we've got a great and very special show for you today. I can't wait to get into our discussion. With me inside the Doctor's Lounge today are our usual suspects, CEO and founder of MD Coaches, Rhonda Crow, Dr. Rick Zollinger, and Dr. Randy Cook. And you know, inside the Doctor's Lounge is a place where we can all come together and have honest and frank discussions. It's unscripted. We never know where it's going to go. And we're really so fortunate today to have a special guest with us. His name is Dr. Bob Baker. Dr. Baker is a gastroenterologist. He's based out of New York City, and he's got a fascinating background and some stories to tell today. And I don't want to steal his thunder at all. Instead of me just babbling on here, we're going to get right into this. But, you know, among Dr. Baker's talents, and they are many, and I feel he's a kindred spirit in a sense. He was a psych major as an undergrad, as was I. I feel this whole concept today that we're going to kind of begin talking about is communication and how as physicians we talk to our patients, but most importantly, how we listen. It's an art form. Simply just talking to your patients is not going to really do any real service at the end of the day. So we want to talk about the art of not just conversation, but the whole idea of performing. And Bob has served, you know, coming up through the ranks as a performer first and foremost, going through school. And again, I'm not going to kind of take away from what he does. It's kind of like the old show, I've Got a Secret. I'm going to let him explain it. It'll become apparent before long. But with that, Bob, welcome to Inside the Doctor's Lounge. We're so glad to have you with us today.
Thank you, Des, very much. I'm really delighted to be here. Randy and I talked some months ago on the podcast, and I enjoyed that thoroughly. And to be invited back is just terrific. I really appreciate it. So thank you very much. You know, before we went on live, Des, we were talking about the photos behind you. I'll just point out to the photo behind me. It's a little hard to see at the distance, but this is Edgar Bergen, the great ventriloquist.
Yes.
Wow. Tommy McCarthy very tenderly away in his trunk. And so Edgar Bergen was an inspiration of mine, and I guess we've given it away. Aside from being a doctor, before I was a doctor, I was a professional magician and ventriloquist. I did have the pleasure of appearing on America's Got Talent. I didn't win, which is why I'm able to be here with you today. And when we were talking about communication, I thought about a cartoon in the New Yorker, which really summarizes it in a way for me. Rhonda, is it possible for me to share my screen? I know it's been disabled. Can you allow me to, or whoever's running it, allow me just to share the screen for a moment?
I certainly will.
Great.
One moment here, as soon as I figure out how to do that.
Yeah, at the bottom where it says share screen,
Here
click on
we go.
that, and then it says all participants.
Yep.
Okay.
Okay,
so
give it a try.
All right, it should show up right about now.
There we go.
There you go. Excellent.
So you can, let me bring that cartoon over. From the New Yorker a couple of years ago. So now I've given myself away as a magician.
Hopefully that didn't hasten that patient's demise. No.
You know, it's funny, ventriloquists have this reputation of being schizophrenic or two personalities or split personality or weird, thanks to that wonderful William Goldman novel Magic and the portrayal of Anthony Hopkins as a truly distinctive ventriloquist. What I always like to point out to people is that a ventriloquist is simply an actor playing two parts simultaneously. That's all we are.
So it's pretty easy, right?
Well, yeah. I mean, as we like to say, a 5-year-old child can do it with 20 years of practice. And the idea, of course, is to create the illusion that the puppet is alive. And we do that by acting as if the puppet is alive. And if we act that way, then the puppet comes alive to people. And that sort of ties into how I feel about medicine, as I think.
So my first question is, you know, in your practice, I'm assuming you brought out some of your characters or your puppets at times in discussion with your patients.
No, I did not.
Thank God.
I'll tell you, I originally wanted to go into pediatrics, where I could do magic and ventriloquism for the kids. When I was in medical school at Columbia, I rotated through what was then called Babies Hospital. And I discovered for me that when the kids were sick, it was depressing. When they were well, it was boring. And not wishing to spend my entire career bored or depressed, I decided to go into internal medicine instead of pediatrics. So no, I kept them apart. I always brought a sense of humor and the understanding that what we're doing is in fact a performance, as you hinted at the beginning. But no, I never, there just isn't time, frankly, to go into a 5-minute routine with a puppet.
See, and I think this raises an important point too, because when we are there having our discussion with our patients and we're it's a teaching moment many, many times, the majority of the time. And that patient is there for a reason, and it's not to hear you. They're in some type of pain or they have an issue.
Yes.
And you're the conduit to try and, get them through that. So, I guess the point is that how do you balance that part where you're conveying your message, but then also listening, because this is an important part of the equation.
Some time ago, I understood, or I came to the personal belief that the doctor-patient interaction is in fact a performance. Mm-hmm. And I don't mean a show, but it's a performance. Mm-hmm. And just as the goal of every performer, be it an actor or dancer or singer or ventriloquist, is to connect with the audience. So our job as physicians is to connect with the audience. And the same techniques that performers use to bond with their audience of hundreds, we can use to bond with our audience of one, the patient. Mm-hmm. And that's what I wrote about in my book, The Performance of Medicine. I'm not here to hawk the book, so I'll just mention it once. And
it's a great book.
I will. Yeah. I have it
I'll
right here on my desk.
I'll get that check right out to both of you.
Bob, one of the things that, I do a lot of speaking at various conferences and have done so over the years. And one of the things that there's a commonality there, it's a performance in a sense, but it's that connection with the audience. It's so important. And I think when you kind of put it in those terms, as you're performing in a sense, it's not like you're putting on an act. What you're really doing is bringing your best game
absolutely
to that moment. And there's a certain accountability that you're conveying to your patient too, or your audience, that I think is so important. You've prepared, you've done your best, and now you have to give that to them. It's sort of a gift.
It is a gift, and you're exactly right. That's exactly what performers do. They rehearse until they get it right. What I always say is that the part that we're playing is ourselves, but not our hassled, worried about the mortgage, running behind in the schedule, wondering what we're going to put on for dinner for the kids' selves, but rather our physician selves, which has to be the biggest, best version of ourselves for that patient at that moment. So just as many performers that I know are different off stage than they are on stage, but they're on stage, they're just bigger, better versions of themselves. And that's what we need to be as physicians, that when we are in there, we are dedicated to the communication with that patient. And I think the way I personally approach that, as I said, is to understand that it's a performance. And there's some very basic performance techniques that any doctor can use to enhance the visit with the patient and give them the best experience and the best medical outcome. Because research has shown that if a patient has a better experience, they're more likely to have a good outcome, whether it's less likely to return to the hospital for follow-up visit, more likelihood to take their medications, and so forth.
Bob.
And less likely to sue you as well.
That is exactly correct.
Although that's not our motivation, it's certainly it's a factor.
Yeah, as you were talking, I have lots of questions, and the one that just kind of popped up is what you just described is really what the patient and the doctor want to have, is this connected time where you're really both present and you're able to focus and you're able to concentrate on what the issue is at hand. Mm-hmm. My question, and it's for the group, actually, I myself, I've got a nursing background. I keep thinking about how fragmented that can become with all of the things that are going on in that exam room or in that patient's inpatient room, even in the procedure room. how do you keep focused so that you protect that? Because, you know, with the EMR and you're constantly being interrupted with cell phone calls or folks who need you to sign this, that, or the other, or I can't log in because I didn't sign my chart. So they held that up for me. So how do you maintain that focus?
Rhonda, I think on that, a couple things. One is you always have to, we've talked about this before, the patient's time is important too. Mm-hmm. You know, and you've heard me say before, Bob, you've not heard me say this, but it's called, my father called it the doorknob doctor. The guy that comes in with his pocket protector with 412 pens, stands at the door and holds the doorknob and then says, what are your questions, da, 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 da. He might be there 10 or 12 minutes and then he leaves. Family comes in and says, well, what did Dr. Z say? Well, he was busy. He had to go. He had to get away. Mm-hmm. And my father always said, and I took it my whole career, he said, you always have to sit down and at some point make physical contact, touch the patient. Sit down like you got all the time in the world. And when I was in the hospital making rounds, I might be there 60 seconds and the patient thought I'd been there for 10 minutes because I sat down, put my hand on at 6 in the morning, they're probably asleep, and said, what's going on, you know? That was one point. And the other point, because I love your mindset, is I was kind of a Patch Adams guy. So my special one that I remember was going in on the holidays where you do break the ice. And my favorite one was you go in on Christmas and you'd wear the Santa hat and I'd take that fish that sang, you know, take me to the river, and I'd give them a candy cane. I didn't want to be there any more than they did on Christmas Day, but you know, it would break the ice and then you could say you got any problems and stuff. So I think you're right. I think you got to be your own personality, and we're all different. We're all, you know.
You know, Rich, in my book, I refer to those moments as what I call moments of patient astonishment. When we do something that is so unexpected, the patients would never remember. One of the tips I give in the book is sometimes in the course of a routine visit, a patient will drop a little bit of information like, oh, my son's applying to college, or my mom's not well. And what I would always do is in the days of the paper chart, I put a little Post-it note in the chart about that. Or now I could put it in the EHR. And 4 months later, when the patient comes back and says, when they come back to see you, you say, oh, before we get started, how'd things go with John's application to college? Did he get into, you know, Stanford, whatever he wanted? Or how's your mom doing? Hope she's feeling better. And they go, I can't believe you remember that. And of course you didn't really, but it creates that moment of connection where you're seeing them as a human being rather than just another number coming through the door. So I think things like you did are great. It's great to astonish patients with the unexpected, just like that. And it humanizes you as well.
Mm-hmm. Yeah. I think it's a good thing.
You know, Rick, you said something too about, you know, sitting down. A great bit of advice I got a number of years back too was one of my colleagues. He would tell his residents who do not, if patients in the hospital bed especially, do not be having the conversation while you're up here and they're down in the bed. Pull up a chair, sit next to them, have that discussion, make eye contact. These are the type of things that shows that, yeah, you do value their time, and kind of all comes back to even putting yourself in their position. I mean, how would you like to be that person? Or if that was your mom or your dad, you know, you just always go from there.
Right, but here's something really, really cool, because you recommend that to spend more time with the patients, as doctors say, I don't have time. But there was a study done at the University of Kansas several years ago where they sent residents to the bedside to speak to patients and had them randomly assigned to either sit or stand while talking to the patients. And then afterwards, the researchers asked the patients how much time the doctors had spent with them. And the patients consistently overestimated the amount of time that the sitting doctors spent by about 40%, even though the doctors who sat physically clocked less time than the doctors who stood. So just by doing what Rich suggested, as you suggested, just sitting down gives the impression that you're spending more time, even though you're not. And, you know, something we should use, as a magician, I'd say, you know, that's like evidence-based magic. I'll take it.
Well, I had this one, Bob, where I would always go in when I was doing wound care at the end of my career here. You know, you'd be late. You were always late into rooms, and it's usually the mother with the daughter. So you've got a 50-year-old daughter with an 80-year-old mother, and they'd be sitting there, and mom's going, where's? So I would get my wife started buying me all these wild reading glasses. I even had some that had headlights on them to read it, you know, sparkles. They were all women's reading glasses from stores. And you'd be surprised. You'd walk into the room and you'd put these on and go, oh my God, where did you get those? And everything melted away. They didn't remember I was a half hour late or whatever. So there are little things like that that everybody uses. It's a good
Exactly
trick.
right. And they're wonderful small things. It's amazing to me how often something small that you do really registers so largely with the patient. So I think that's great. You know, as a proceduralist doing procedures in my office, I would often be running late. You know, someone had 10 polyps instead of none, and what I would do is I would go out to the waiting room to someone who I knew was sitting and waiting without violating any HIPAA rules. I'd sit down next to the person. I'd say, I know that you're here. I'm running late. Someone before you had a complicated procedure, not complications, but complicated, but I know that you're here. We'll get you as soon as possible. And although I didn't violate any HIPAA regulations, I said it loud enough for every other person in the room to hear. So yes. I say, yeah, here's a doctor who cares. And he comes out and he sits down and he talks to the patient. And that calms down everybody else in the room too. It takes maybe a minute of time, does a world of good.
I'll tell you something that I did. Took me a while to learn it. I'm a little bit obsessive compulsive, which I think you would like your surgeon to be. But in any case, in the office, I was a nervous wreck because I was always behind. And after a few years, I figured out that was just always going to be the case. So except for the first patient of the day, in most cases, when I entered the room, the very first thing that I would do is apologize. And I would say, I know I'm late, but it's my policy to give every patient I have as much time as they want with me. And I'm going to do exactly the same for you. And when you open the conversation that way, it always seems to go a lot better.
Yeah. Randy, that's great advice. I found myself too in wound care too, same thing. You know, I tell my patients, look, some days it's going to be your turn where you're going to need more time. And you know, people respect that and, you know, be proactive, like Bob was saying too. You know, you go in, you just let them know, and then they don't feel like they're just sitting there or that they've been forgotten. I think that's what people want to know, that you haven't forgotten about them. And, you know, it's amazing how at the end of the day, we always manage to still pretty much get our clinic out at the same time, despite everything. So,
and don't you think, Des, these are also, when we talk about the patients, these are also wonderful coping mechanisms for ourselves. I mean,
yes.
You get a long day, you get worried, you had 9 polyps and you're an hour behind the next colonoscopy and, you know, whatever. And people, it helps you to put some humor and some direct communication with the patients, because then you feel better and the day's more fun.
For sure. And it, you know, you're also conveying a certain respect to them too. And you know, you just want to, you know, you treat them how you would want to be treated, let's say.
There's one other thing that I discovered was profoundly important, and that is if you've done a biopsy on somebody and it is some kind of malignancy, when you get together with that patient the next time, if you've booked a 15-minute appointment, you have done them a great disservice.
Right.
And I simply never, ever did that. Those patients always were booked for 60 minutes. Sometimes it took longer. But in those situations, you just have to respect what the patient is going through and give them as much time as they need.
And I remember we talked before, I said when I had a death, which, you know, I always went back and I never went to bed until I thought, what'll I change the next time? But I would always follow up those patients' families in a month with an hour. I'd have an hour. And because luckily it wasn't many over time, but you give them an hour and I would sit there, have you got any questions? Anything, what could we have done differently? I don't know. I wish we'd had a better outcome. And the families appreciate that. So that's not a fun hour, but it's worth doing.
You're so right. And
it's also a healing hour.
Yeah.
It brings healing.
Yeah, it does. I found that it did as much for me as it did for the patients, I think.
Yes.
Absolutely. Absolutely. You know, and the honesty with the patients is so crucial because they have questions. You know, someone mentioned, I think it was Des mentioned before about getting sued. We had a horrible case in our office of someone who was admitted to the hospital with CHF, congestive heart failure, and was on a respirator and was doing well, and then all of a sudden died. And it wasn't clear. And I got a call in the office, and it was the nurse from the ICU telling me what happened. And I said, okay, I'll call the family. She said, well, Dr. Baker, there's something else. The reason it happens, apparently they're working on weaning the patient, and the respiratory therapist accidentally mixed up the input and output tubes on the respirator, and killed the patient, essentially.
Yeah.
I called the family. I said, I need you to come in. I said, you know, after I broke them, I said, but I need you to come in and talk to me this afternoon. And I sat them down and I said, I don't know how to tell you this. So I'm just going to tell you the truth. I'm going to tell you what happened. It's horrible. They ended up suing the hospital, the ICU doctors, the respirator manufacturer, the respiratory therapist, everybody down the line, except one person.
That'd be you.
So, you know, even so, having those conversations, any type of hard conversation with a patient, it's so hard for us. I think we want to run away. We don't want to deal with it. We don't want to think about it. I mean, I felt that death personally, although I had nothing, it had nothing to do with it. But you feel it so personally that what you said is exactly right. It's therapeutic to us.
And you can be sure that family had to stand up for you, because we all know that the lawyer wanted to sue everybody in the county.
Exactly.
That's a great point, Randy.
Yep.
That's a great point.
Yes.
You know, the other
and recognizing people not as patients but as individuals. And I can just tell another very quick story about my daughter. After my daughter, I had 5 daughters, but after one of them graduated from college, she was living at home and she was sending out job applications. She wasn't doing anything. And finally said, listen, you have to get a job. Okay. So she got a job in the local Barnes and Noble as a checkout person. And after a couple of days, she came home and said, first of all, it was great for her to learn how hard she had to work to earn $8 an hour. That was very important. But also she said, people don't look at me. I mean, they act as if I'm not even there. And it gave her and me a renewed appreciation of how much people want to be recognized. Mm-hmm. And that's why those little tips about, hey, how's your son doing at college and so forth are so important. Anything that shows that we recognize people, as individuals, and not just another body coming through the door. And I know just from talking to everybody here, we all did that. But there are so many of our colleagues who are discouraged or too busy or just not in their mindset to do stuff like that.
You know, the one that got me, Bob, thinking this is another tangent to this, is when you have a complication. And for me, let's say I had a post-op valve replacement or something, and the patient had a stroke. Mm-hmm. And of course, the neurologist is on his way flying through, tell the family, there's no chance, going to die. Good luck. Have a nice day. And then the family would come to me, and I would always say, he doesn't know that. I don't know that. He knows that. Mm-hmm. Everything else is doing fine. Let's hang in there a while and see. He went through all this. Let's see what happens. And I would never steal their hope. And I would tell you that I would bet that at least half the time, maybe more, the patients would recover, or they might go to rehab, but they would recover from that event, whatever it might have been. And so I learned early on, never take away anybody's hope. Now you have to get, if with time passing it's hopeless, okay, you're honest with them. But I was amazed at how many, especially for me, nephrologists and neurologists would come through and go, kidneys are gone, have to have a transplant, or you got to have dialysis. No, brain never comes back. And it drove me crazy. And then that's just just a pet peeve. I don't know why.
Well, that's taken us into one of those tangents that I would like to follow up on. And I'm interested to know why would any physician behave that way? And I had exactly the same experience with neurologists and neurosurgeons, occasionally nephrologists, the really truncated specialties who are kind of working on one organ. It was, deliver a diagnosis and get on down the road. Why would anybody behave that way if they wanted to be a doctor, for crying out loud?
I have a theory on that. I think they're.
I
That's
can't
how
wait to hear it, Mr.
Yeah.
Foot
Well,
Doctor.
I think
Because I don't know. I want to hear what you think.
Yeah.
Well, so how we deal with the stresses, whether it's a little bit of humor or whatever. Some people compartmentalize things, and that's just how they deal with all the unpleasant. They emotionally, divest themselves from that situation. As terrible as that sounds, they put themselves in that box. They are a technician at that point. They don't want to get emotionally attached. It's a defensive mechanism, really.
I think you're right.
Wow.
Randy, that doesn't mean it's right or wrong. I think it's just that this is how, some people see up, some people see down, and that's just.
It was interesting, Des. It would be like you working with vascular interventionalists. Bob would have a great association with you, Randy. I mean, gastroenterology and general surgery usually had a copaesthetic relationship.
Yes, we did.
Cardiology, we did until late years, but we did for the most part. You worked together and tried to give the patient the best outcome, and those specialties seem to work together just fine. But you're right; it was the outlying silo guys that used to drive me crazy.
It's also.
Well, you know what? You may be onto something, and that is many of the people that you seem to get, many of the physicians that you seem to get the most help from, and seem to be willing to get on board with you, are the physicians that are in some way. I hate to say it, guys, but look, we tell the truth here. You are in some ways financially dependent. The referrals work both ways, whereas you never call the neurologist until somebody can't wake up, right?
Right.
I was always fortunate to be in a multi-specialty internal medicine practice, so we sent out many more referrals than we took in. Our practice grew because of who we were, not because people were. Our patients were sending to us as opposed to other doctors. So
that's interesting.
We didn't have to do any of that stuff.
I was the first 13 years of my practice, I was in a multi-specialty group, and it was much more like we were all on the same team, and we kind of helped each other out. But the ones that you never see, not even in the doctor's lounge, you come in and they apply the appropriate CPT code, and then they're gone, or ICD-9 code.
I'd like to follow another tangent that you suggested, Randy, and that is when patients would say to you, Doc, what's going to happen? Is he or she going to live? How long is this going to go on for? What's going to happen? I'm curious to know how you would handle those conversations and what approach you would take with patients.
It's always the same, and it comes up a lot, came up a lot in my practice, and that is simply to be as absolutely honest as I possibly can, point out the fact that there's not one of us that can see into the future. When we're talking about cancer in particular, you give them the statistical data, and then you remind them that if you're a single patient, those statistics are completely meaningless.
It's either 0% or 100%.
Yeah.
Right.
I don't think there is, for me, there was no other way to approach it than to simply be honest and remind them that regardless of which way this thing's going to go, I'm going to still be around.
Yeah.
What's
I think, Rick touched on something earlier about giving hope, and it's important that's so important. But you also, I would always remind my patients to look, I don't want to give you false hope either.
Right.
And I'm going to do the best I can with what's available. I'm always looking for a better way to solve this. And, I think if you have that discussion too, and like you said, Randy, if you're honest and you lay it all out there, from the first day, even, it just kind of, it takes some of that pressure off too. You can't deliver, if you promise something, you can't deliver. That's the hardest thing for you and your reputation. I mean, we're not Supermen either. We do the best we can.
The most interesting statistics I'll bring out is that I had a little spiel that I would do about, doing a heart operation. I'd say, I'm going to cut you open with a chainsaw, do some plumbing, and close you with a coat hanger. About 6 weeks, you'll be good. and I don't get paid as well as the plumber. And all the farmers, the farmers would all love that kind of conversation. But I forgot where I was going with the idea. I'll think about it. I'm sorry.
Well, you can solve anything with WD-40 and duct tape. You know that.
Yeah.
They can relate to that.
That's the Greek wedding.
So,
I know what I was going to say. So the difference between if you go in to talk to somebody like that, Randy, and they're 45 or 50, and you go in and talk to the 80-year-old, and the 80-year-old says, okay, crap happens. Let's give it a rip, and I know what my riffs are. And they do great. They walk out of the hospital in 4 days. And you got the 50-year-old, oh, God, why me? They'll be there for 3 weeks and have everything happen to them. And there's something about this that has a great influence on your outcomes going in. And I don't know what that is, what that wiring is.
You know, it's a completely different outlook on reality depending upon what stage of life that you're in. And you're exactly right about that. The conversations with the middle-aged guy that's trying to put kids through college is completely different to somebody who is in their 80s. Not for me, not necessarily that one was easier than the other, but it's Bob, it's a different audience, right? You have to play to the audience you have.
Yeah, exactly correct. And I think it comes back to another thing about that has been touched on about being totally honest. What I would say to patients is something similar to what Des said. I said, listen, if I could predict the future, I wouldn't be in this business. And before I get to what I would say to the patients, also, there was a fascinating statistic. A study was done of ICU doctors, asking them to predict when a patient was admitted to the ICU, whether the patient would live or die, just 50-50, one way or the other. They did, and you figure ICU doctors who have seen so many patients like this should be able to predict fairly well. They did no better than chance on their ability to predict. And I used to say to patients, I've learned that nature has a way of making a liar out of me. And that if sometimes I think a patient is not going to do very well at all, and they rally and they have a great result, and there are other times I figure, well, this person's going to do fine, then some catastrophe happens that was unpredictable, and they don't do well. So all I can promise you is that I will be with you, much as Rich said, I'll be with you every step of the way, and together we'll do everything we can, and it's not going to be our decision.
It's very humbling, as you all know. I tell myself all the time, I feel like a field goal kicker. I'm as good as my last attempt, because you can be a hero 1 second and you can be the bum the next, and that's just how it goes. So you can't.
Yeah, well, you're in Florida, so we understand that. You know, Florida State's not far away, so they're wide enough.
Now it starts.
Here we go.
I was waiting.
All right, so that brings up another question, Rhonda. I saw that the password for this was Go Bucks.
Yeah.
Are you referring to the Milwaukee Bucks, the Tampa Bay Buccaneers, or the American dollar? I just want to know which of those three.
None of the above.
Go for three.
The Ohio State University.
Oh, I missed totally. Oh,
yeah, you missed that kick.
I'll tell you.
I gave myself away as not being a Bigfoot.
Look at Randy's shirt.
I'll tell you why she picked what she picked, and this is the only defense that I have.
It wasn't going to be Roll Tide.
Oh yeah, this is going to come off the rails pretty quickly.
Yeah, well,
Bob, I was struck by that story of your daughter. I really was, because as I was listening to you describe her emotions of how she felt about that, and her take-home message. People didn't, maybe make eye contact or converse with her. She was kind of like an extension of the checkout process or whatever it was. But her statement that she just wanted to be seen, she wanted to be heard.
A good tip for that is I'm sorry to interrupt. I apologize, but that's okay. Somebody taught me the one where you go in and you always address McDonald's by their name tag. So when you go up to, you say, "Hey, Bill, thanks for the double cheeseburger," and they look at you like, "Oh yeah, you're welcome."
Yeah, it's just you're taking away that dehumanization factor of it, because they're just a clerk or whatever. How people, no, you treat them as a fellow person going through and respecting what they're doing.
Yeah, after that
There's no job below any of us. We all have our role in this. And I have so much respect for the guy who just has that work ethic, no matter what, if he's cutting somebody's lawn or he's painting a house, whatever. Just do the best you can. But, you know, I guess where I was going with this too is that your daughter's experience, you look at what's going on in the world right now. Really, if you boil a lot of this stuff down, people just want to be seen. They want to be heard. They're crying out. There's a lot of pain out there. And if we would just maybe show some humanity to our fellow citizens, it goes a long way. It really does not sound preachy.
Right. But it's really difficult when I have someone insult me in a store because I'm wearing a mask. What's wrong with you? What are you wearing that thing for? You know there's no COVID. I mean, I don't want to go down this rabbit hole. But when you're attacked like that, it's hard to come back. The only thing I could say, what I actually said was I'm wearing it to protect you.
Yeah.
Yeah.
Yeah, I mean, I don't want to get into this stuff.
You know,
we're not going political for sure. This is, you know, but I think it speaks to just, we're all here. We're all passing through. And you know, just don't forget that.
I have to tell you that fortunately I haven't seen much of that, but I did have one individual in the last couple of months that gave me that assault. And I turned and I looked at him and I said exactly what you said, but I said, "This is for your safety. I have Susie-Gamuchi fever, so you better stay back."
Yeah.
I'm going to have to look that up online. I'm not familiar with that disease, but I'll read about it.
You know, they were Googling it as soon as they left. You're like, what the heck was that?
Oh my God. I just saw I'm wearing a mask, but I'm not wearing underwear, so it's a trade-off.
I had to choose today.
Well, in North Carolina, it seemed everybody's pretty respectful, I think, at least in where I live, of doing that. And so I haven't been encountered with that. And a lot of the businesses, frankly, just put huge signs out front that says you can't come in if you don't wear a mask.
Right.
So please don't berate our employees. Please don't yell at anybody. If you want to come do business, we're happy to have you, but wear a mask. And, you know, that's fine. That's cool.
I mean, you know, my wife, Debbie, would say to me, you know, it's like, you can't be judging people because they're wearing a mask. They may be compromised too. You know, my mom is dealing with lung cancer and all that stuff now. She doesn't want to be exposed to that. So, you know, again, put yourself in the other person's shoes or try to be. Have some empathy.
What I have to say, what I love is people who say, "Oh, I can't wear a mask because I have a respiratory condition." I'm a doctor. I can't think of any respiratory condition that would keep you from wearing a mask. Or they say, "Well, it's damaging." I say, "Well, you better, then maybe you'll want to tell your next surgeon not to bother wearing a mask in the OR."
Yeah,
you know, look, this is all temporary stuff, but it's been a fascinating study in human behavior too, and social psychology for sure. Uh-oh. Here we go.
I had to bring this for you, Bob. I found it in the closet. It's Dr. Fooling You. I was going to, but I can't do any of it. I couldn't do that like you.
Well, I will say that I did bring a couple of my characters.
Oh, there we go.
Here we go. We've been waiting for this.
And I'll introduce you to two of them. You know, like you, Des, I do a fair amount of speaking, or I did until this happened, to medical groups. And one of the groups that I speak to a lot are nurses. And there's always a little bit of discomfort because of the medical hierarchy of a doctor talking to nurses. And I wanted to figure out a way to let them understand that I heard them, I understood them. And so I created this character, Nurse Judy Edwards, and my speeches with nurses, I tend to start laughing.
I can't wait to meet Judy.
Probably already know her.
I'm thinking, I think I know her. I think I know her.
There we go.
Hello, Judy.
Yeah, hi, Judy.
Oh my, what a handsome group of people. Very nice. Who are they? These are all physicians and people who care about physicians. Why would anybody care about physicians? Okay, so Judy, why don't we show people how we originally met, okay? Sure. It was my first day of internship, and I came onto the floor, and I said, "Good morning, nurse. I'm Dr. Baker, the new intern." Oh, God. Do you have any questions for me? Do you have any questions for me about Mrs. Jones in room 6?
Mrs. Jones, Mrs. Jones. Oh, do you mean the 86-year-old diabetic lady who's admitted with cellulitis and a fever of 102, a light count of 13.7, and a hemoglobin A1C of 12? Yes, that's right. Mrs. Sarah Jones, who fell and she cut her leg, but the poor dear didn't see her doctor for 5 days because she didn't want to bother her daughter, who's a working mom with 2 small children. I didn't know that either. Oh, Mrs. Sarah Jones, who's being treated with vancomycin, Zosyn, glucophage, insulin, and soaked QID. Yeah, that Mrs. Jones. That's right. No, I have no questions.
None.
Do you have any for me, doctor?
No, I don't think so.
I love it.
So anyway,
Bravo,
That was great.
Her Crocs and her scrubs.
Oh.
You're pretty cute yourself.
Okay. So I find that when I do that for the nurses, I've got them. Right.
Oh, yeah.
I bet.
Oh,
Because we all know
had
her.
Me.
Right, yeah.
You had me quickly.
All met her along the way.
Yeah. And we've all been humbled by her as well.
Oh, yeah.
Oh, yeah.
Yeah.
I remember
that's wonderful.
the first day during medical school, I was on my surgery rotation, and I scrubbed up and I walked into the OR, and this battle axe of a nurse said to me, "You just contaminated yourself. Go scrub again." Okay. Walk out, did the whole 10-minute thing. This time I backed in really carefully, and I walked, I started putting my gown on. She goes, "Don't you learn? You just contaminated yourself. Scrub again." Okay. I later found out she did that at all the medical students. MO. I guess presuming that eventually they would grow up to be doctors who would torture her, so she'd get her, kicks in her. I don't know.
Oh, yeah, yeah. It's funny. The thing that struck me on Nurse Judy, though, too, you can carry this over to your discussion with your patients, too. It's a lesson I learned a long time ago, too. Don't ask your patient, "How are you today?" Because you might get the whole litany of things. It's learning how to control that conversation in a sense.
I have a question for all of you. Since we're talking about communication with patients, what would your opening words be to patients when you walked in the room?
Mine was easy. My name is Rhonda, and it's okay if you sing "Help Me, Rhonda." I'm here with you 12 hours. Let's talk.
I like that's a good one, Ron.
I would always say, "Hey, hi, Dr. Z. How I didn't say how you're doing today. Say, are you? I can't remember what I said because I come in. Golly, what did I say? In an exam room, I don't know. In a hospital room, I know.
Yeah, depending on the setting.
I didn't ask how you doing, but I can't remember.
Introduce yourself. I would always introduce myself. Certainly, I've already kind of reviewed what's going on with them, so I try and know what I'm dealing with before I walk in the room.
Yeah.
And do my assessment, and then just start, trying to, whatever information I'm trying to extract from them, that would be where the question would go, essentially.
I think you could say, "Good to see you again," or "Glad to see you. I'm Dr. Z," or something. I never asked them, "You're right. How you doing?" or else the day would stop.
Yeah, I always start off by asking them, "How may I help you today?"
Yeah, that's a good.
That established that I was there for them, and that they were granting me permission to be of service to them.
I love that, Bob. We've actually had a little discussion on this in a previous show about how people used to greet each other back in let's say the 1700s or so. It's like, "How may I serve you?"
Yeah.
It was just a normal greeting. And Ron, we were talking about that. I love that. That speaks to that whole concept.
Your servant,
and unless you're waiting for Outlander's bedroom scenes like Ronald, then they're not doing any of that.
I think that reference just went right by me.
Well, it actually, kind of leads me to something, though. So, we all have different little things to decompress or to kind of, our little pastimes that we like to pursue. Bob, you're obviously one of the busy guys in the room. One of my favorite sayings, too, if you want something done, you find the busiest person in the room. With all that you're doing between your speaking, your practice, the little entertainment part of all this performance, being an author, how do you take time out for yourself? How do you maintain that balance too? Because there's a lot going on, and you're a giver too. I mean, you're giving constantly. So,
well, I think all the things I do, being a doctor, is something I do for myself too.
Yep.
It's interesting. I'm now 68 years old. And one of the things you do, as those of us who, and I know you're all younger than I am, I can tell by looking, but one of the things you do is you sort of say, what makes your life meaningful? What gives meaning to your life? And I decided some time ago that what gives meaning for me, because an artist will say creating beautiful art, an athlete will say being the best I can at what I do. But for me, the answer was, what gives my life meaning is what I can do for other people, period. Whether it's being a doctor, whether it's entertaining them, whether it's trying to help my kids grow up to be the best that they can be. And that's it. And I think that one of the great things about our profession is that when it's, and God knows there are things that are discouraging and things that frustrate us and make us angry and make us discouraged. But at the end of the day, when we look back, we will not have manufactured the most widgets. We will not have sold the most product. And let's face it, gang, we will not have made the most money. But there will be thousands and thousands of people whose lives are better because they met us. That's the best damn job in the world.
You're here, man.
I want to ask you to comment on one thing that I bring up from time to time on this show, Bob, and that is I fear that the capacity for us to take that attitude is being taken from us because so many of us have become employees first, and now not even physicians, we're providers, and
commodities.
We hear a great deal about physician burnout and all the things that cause it, and I think that is the causative organism right there. This reality that it is almost impossible with the educational debt that accumulates for any physician, any medical school graduate to be an independent operator of their own business and have a relationship that exists between themselves and the patient and no one else. This idea of the employee physician has been very destructive, I think, and I wonder if you have any thoughts on that.
I do. I have a lot of thoughts about it. And that's why I think it's important to go into that room with a performer's mindset. The performer's mindset involves many things, but the two crucial ones for us as doctors is, number one, as I said at the beginning, what do performers want to do? They want to connect with the audience. They want to create that connection, no matter how they do it. So we want to connect with our patients. But another aspect of the performer's mindset is their ability, when they are on stage, to exclude everything else going on in their lives and concentrate on being in the moment in that performance. And so look at actors who do the same show night after night after night. It can become routine. Mm-hmm. So they are trained to remain in the moment so that if another actor changes a line or does something different, they can respond. And we go into that room to push everything else away and say, I am here to connect with that person, for me, that audience, and just let everything else go. That's the only way I've been able to handle it. When we're in the room, face to face with that patient, that's when we're in our element. That's what we've trained to do. And that's where we go in there and we use our experience and our training and our skills and our knowledge, all for the purpose of serving that patient. That is our domain. And when we're in there, that enables us, I hope, to push all that other stuff aside. And because the only thing that matters really to that person is what happens when we're in there with them, because they don't know all this other stuff. They don't know about our financial stresses, about the 2 lawsuits that we're facing, that our kid didn't get into college. They don't know any of that stuff. They don't care. All they care about is that we give them the best of ourselves. And for me, that's our best performance for the time that we're in there with them. And that's what I did. And I think as long as we remember why we're there, we are there for that person, for that family, and nothing else matters at that moment. then we can bring the best of ourselves to that interaction, no matter what's going on around us. That's what I mean by the performance.
That's so well stated. And I think, to Randy's point too, knowing yourself, what makes you happy, what gives you the most joy, and recognizing that our careers and what we've been trained to do, like you said, Bob, provides us so much enrichment, enjoyment. And so if you never lose sight of that, then you can put a lot of this other stuff to the side. And Randy, you're right. It becomes more difficult. It's certainly over the years become more and more of a challenge, without question. But if you strip all that stuff away and get right down to it, if you had to just kind of narrow it down to what makes me tick, what gives me the most satisfaction and happiness, then you can deal with a lot of this. I mean, that's been one of my little secrets. I blocked out so much of the BS over the years and just said, just stay focused on why you did this in the first place. Because when you made that decision to go into medicine, you were of sound mind. You had done your homework. You knew why you wanted to be there. You addressed your calling. And so don't let all this other stuff, this background noise, distract you.
There's a famous, his name escapes me at the moment, but there's a famous golf instructor from Texas who's no longer living, who wrote a book called The Little Red Book.
Harvey Penick.
Penick. And his biggest tip was, at this moment in time, the most important thing in your life is this shot.
That's right.
And so he's saying you have to stay in the moment. Don't be thinking of what's going to happen, what did happen right now. And I think that's the key about the communication. Now, what Randy said,
yes,
I don't know how the kids, it's a different world. So they're going to have to, they're coming into a different world completely than you and I, Randy. I don't think they're coming out.
Well, I think we probably need to spend some time on thinking about how to prepare them, because what they face is profoundly different from what you and I faced when we went into practice. They will be employees, and they will be treated like employees. And I think Bob is absolutely correct. The ability to compartmentalize into a separate space what you do with the patient, as opposed to what you do when you walk away from the patient and you deal with the case managers and the hospital administrators and the Medicare people and all that. You really have to find a way to move from one space into the other, and if you're not effective with that, it's going to be terribly demoralizing.
Well, I think what Bob said with his course to the nurses, I think that's what we've been talking about trying to do. That course needs to be instructed to junior and senior medical students and bedside manner, and here's what you're going to encounter. It's like I say, they talk about all these college football players. They should be teaching them how to buy a mortgage, how to open a bank account, how you get an auto loan. What is amortization? These kids come out and they say, boom, and that's another thing. But I do think with medicine that we can go and help instruct these kids when you're our age. And by the way, Bob, you're just a kid, because I'm 69. The hell with that commentary. But
everybody in this room is a kid except me.
I gave
you
up.
guys show me some respect.
I gave up on Grecian formula a long time ago.
Hey, well, I have no need for Grecian formula. So
Okay.
Hey, Rand, I guess, Des, you asked, what do I do for myself? Another thing I wanted to mention, Randy might appreciate this. In the last year, I have taken up learning to play the 5-string banjo.
Wow.
There you go.
Yeah, and I'm getting into bluegrass, and there are two styles of banjo. There's bluegrass, like Earl Scruggs played. There's also something called clawhammer banjo, and I'm learning them both, and it's really exciting. I will not play for you. I'll probably never play for anybody except for myself.
Bob,
but it's a ton of fun.
Over my shoulder, with my fingers pointing, that's my bass. I kind of did the same thing. I'm not trying. I learn. I take lessons online. I do these things. I just play for me. It gives me great enjoyment, and you're focused on something away from everything else.
Yeah.
The only thing I can say to that,
guitar in the background.
The only thing I can say to that, Bob, is that you clearly feel that you have many years ahead of you, because this is going to be a lengthy project.
Randy,
why do you say that, Randy? Because sometimes people say, "What do you regret?" Well, do you regret this or no? I regret I didn't start the banjo 20 years ago.
Yeah,
really.
Yeah. Sometimes I thank God, like man, if I had picked this thing up in high school, I probably would have never, I wouldn't be sitting here right now.
Yeah.
I've gotten in a lot of trouble, I'm pretty sure.
I'm trying to conjure up a banjo and bass band here. And then Rhonda can be the lead singer.
Rhonda knows her bluegrass.
Randy knows what a bluegrass band is. It's a banjo, a guitar, or a bass. And
that's right.
And, you need a mandolin. You need a fiddle.
Mandolin. And what is one that the guitar? I'm blocking
the dobro.
Dobro.
Right, a dobro. So hey, come on, we're three-fifths of the way there already.
There you go. It's fun. I mean, it really does fire up a different part of your brain, and it's a great release. I mean,
and I'll be honest, I do it for another reason too. My dad died with Alzheimer's disease, and so now that I'm not actively practicing medicine, I'm constantly trying to learn new things.
Yes.
I don't know if it'll work or not, but to keep this thing learning.
Oh,
absolutely.
I'm doing online languages on my phone, and the one I'm doing that everybody says, "Why are you doing it?" is Czech. When the hell am I ever going to speak Czech? But it is so damn hard that I did it this morning, and I can do a Spanish lesson in 10 minutes, but Czech takes me 45 minutes, and I still can't get it right. But,
you know why? I had that problem too. I've studied a lot of languages over the years. So, for instance, when my daughter married a boy from Sweden, he's living in America, but a Swedish boy, and his family came over. And so it's a tradition in Sweden to give speeches at weddings. So as a surprise to my daughter and her fiance, I did the Pimsleur Swedish course, and then I delivered a 3.5-minute speech in Swedish. Do you remember any of it? No. But along the lines of what you're saying, Swedish.
I got goosebumps. That's so sweet.
That's awesome.
Swedish is sort of has some roots in German, and I had studied German ages ago. But I've tried to learn languages that have no relation to Western languages, like Korean, because we have a lot of Korean patients. I went to Japan. I tried to learn Japanese. The sounds, the structure, everything is so different. I found it was a roadblock for me. I just couldn't. I
love that. The fact you're doing it for yourself, but also, again, it's back to you're giving a little gift to those people around you. That really is a beautiful thing.
Can I make a confession?
Sure.
When my daughter got married, her mother and I were divorced. And so, of course, each parent was going to say something to the guests. And she got up and she said in Swedish, "Hello, it's nice to see everybody." And the Swedes all stood up and they thought that was great. And I'm sitting there going, oh.
Oh boy, I got her.
Yeah. You won't tell anybody else about this. Okay? And by the way, I don't know how long we're going to go, but I also did bring the character that I performed on America's Got Talent with.
Bring him up.
You want to see? Okay. His name is Sigmoid Colon, world's only talking large intestine.
Did you guys watch his video on that?
Yes, I've seen that.
Everyone I could find.
Nice.
Oh, this is what it looks like where the sun does shine. It's a little strange to be talking to a colon. Really? Your friends say you're always talking out your ass. Say, who are all these people laughing at us? Well, they're doctors. Any surgeons? Yes, surgeons. Oh, I hate surgeons. Really? Yeah. Last week, some surgeon operated on a colon buddy of mine. Went in there, took half of them right out. Oh, I'm sorry to hear that. Yeah. Now he's a semicolon.
Rim shot.
Yeah, rim shot.
That was absolute. That was terrible. Hey, my jokes are supposed to be crap. What's your excuse? You are really grouchy. What do you want? I'm an irritable colon. Well, why should that be? Because I don't get no respect. You people ask me to do your dirty work, and do you thank me? No, you just sit there, look at your phone. Working in my profession deserves respect. What profession is that? Waste management. I think that we treat our organs the same. You do not. You favor the heart. You think we favor the heart? Sure, it's got to be number one because I'm number. Say, these doctors are quick, aren't they? Now, why do you think we favor the heart? Oh, come on. You give it its own holiday on Valentine's Day. You write songs about it. I want to know, when am I going to hear Tony Bennett sing, I left my colon in San Francisco. I came home with a colostomy bag. No, we're not going to hear that. How about Janis Joplin? Take it. Take another little piece of that colon now, David. You know you got it. It makes you feel good. All right, that's enough. That's Sigmund.
Good job. Hey, Sigmund, does he have a pair of shoes to match that that bag?
Oh my goodness. Who knew there were so many crap jokes?
Oh, man.
Oh, you sit down and you
don't act like you don't know. Come on.
It's tough out there. You got to look out for number one. Just don't step in number two, right?
I got my sound effect button, but I couldn't find the right one.
Oh, you didn't have your rim shot ready.
No.
Boom.
Bob, those were great. Thank you.
That was awesome.
You know, this time has flown by today, as we knew it would. We knew this conversation was going to go into multiple directions. It certainly did not disappoint. Bob, what a pleasure it's been having you with us today.
It's been an honor for me. I mean, to meet with people who share my values and who are clearly, truly physicians and surgeons in the very best sense of the word, and nurses too, let me say. But to meet with other people who care about these issues and who want to impart this knowledge to the generations coming up is fantastic. And I'm really honored to be part of this group. So thank you very, very much.
It was a blast. I'm so glad you were with us today. Randy, do you want to add anything before we wrap it up?
I will add one thing, and that is I'm going to put in a plug for Bob's book, which he was good enough to sign a copy for me. It's great reading, certainly for any physician. I think nurses would enjoy it too, but even people who have no connection at all with what the practice of medicine is about, I really think that they would benefit from this thing. I think it would probably help them understand that there is something going on in that space over there that maybe they don't know about. And so I recommend it to everybody. I enjoyed every word of it. And thank you for making it available to me, Bob. I really enjoyed it.
My pleasure. It's called The Performance of Medicine. It's on Amazon, not surprisingly. And I hope that if any of you read it, that you'll get in touch with me. I'd love to chat with you.
Absolutely.
Fantastic.
Rick, anything else to add?
Who, me?
Yeah.
I don't know.
He's down there looking for more props.
Yeah, I got all my props. I had him. I was all lined up to tell Bob he was a star, but I can't make my star shine.
Yeah, you got to rehearse this stuff ahead of time.
I know.
There you go. It's the performance. And lastly, Rhonda, anything you'd like to add today?
I just appreciate so much, Bob, you joining us. And I know we've already put a plug in for the book, but there is so much solid information and pearls of wisdom in there that can help all of us. Thank you for taking the time to put it down so that you could share with all of us.
Thank you very much.
So glad that you came to be with us.
I really appreciate it.
But before you sign us off completely, I'm also going to put in a plug for not just Bob, but myself. His episode of Prescription for Success is still out there on our website, rxforsuccesspodcast.com. I think it's a fascinating conversation. So
it really
one more
is.
thing I'd like to add, if Rhonda, if you would send me Des and Rich's email addresses, and then if you guys will send me your snail mail addresses, I would love to send you each a copy of the book.
Oh,
I'll do that for you, Bob.
Thank you for that.
Thank you very much.
And Randy, I'm glad you brought that up because it is really a fascinating conversation. That was an excellent episode of your podcast. I want to remind all of our viewers today of Inside the Doctor's Lounge, check out Randy's RX or Prescription for Success podcast. It's outstanding, excellent quality. And like Inside the Doctor's Lounge too, sometimes we don't know where the conversation is going to take us, but it's always a lot of fun. I just like to say one last thing too, besides Bob, what a great honor and pleasure was having you with us today. You're always welcome to come back and join us, because, you know, that's what happens in a doctor's lounge. You never know who's going to stumble in and where it's going to go.
Thanks, Des, but you've seen my shtick now. I ain't got nothing else.
Oh, I don't buy that.
Yeah.
But, you know, one of my little take-home points from today too is that, you know, we can't undo the past. That's done. We can't control the future. And so living in the moment and being there, I think it's a great philosophy to adopt, and don't forget that, you know, just extract everything you can from every day, every moment. And that's one of the little tips for a rewarding life. So,
Yes.
you know, with that, again, we hope that you've enjoyed today's episode. That little red button on your screen, hit it. Please subscribe to Inside the Doctor's Lounge. The things that we discuss, again, are really unscripted and honest. And we just love being here and sharing with you too our insights. And we hope that you'll find yourself inside the Doctor's Lounge in a future episode. And just remember, for MD coaches, we see you, we believe in you, and we're here for you. Until next time. What is the performance of medicine? It's probably not a question you've contemplated much, but among other things, it happens to be the title of a book by our guest today, Dr. Bob Baker. Bob is a gastroenterologist, but he's also extremely talented and accomplished in all sorts of areas. Among other things, he's got a talent for ventriloquism, but he's an author, as I mentioned. His book is certainly well worth the read, and having him today as a guest really reminded us of certain things. You know, how we talk to our patients is so critical. And Bob, despite all of his accomplishments, is so humble. And I hope you really appreciate his insight and some of our banter that we had inside the lounge today. You know, Inside the Doctor's Lounge, again, is a place where we can all come together and share ideas in a really fun and unscripted but honest way. You never know really what's going on behind the doors of a doctor's lounge. So we hope you're enjoying this. You're always welcome here. And by all means, please subscribe. Hit that red button on your screen and be part of the Inside the Doctor's Lounge. Until next time, I'm your host, Dr. Desmond Bell, for MD Coaches and Inside the Doctor's Lounge. Remember, we see you, we believe in you, and we're here for you. Take care.